Tuberculosis continues to be a significant public health problem in the African region. According to the World Health Organization, an estimated 2.5 million people fell ill with tuberculosis in this region in 2022, and around 400,000 people died of the disease in the same year. Both TB and HIV pose another major challenge on the continent. In 2022, approximately 20% of new TB cases were reported among people living with HIV and AIDS, reflecting the heavy burden of HIV in the region. However, tuberculosis can be cured if those with TB are identified, start and adhere to their treatment. To discuss these and ways to help, solve this issue, the Human Sciences Research Council is hosting the World Tuberculosis Day seminar in collaboration with the South African National AIDS Council and the Aurum Institute to create awareness around tuberculosis in the week leading up to Tuberculosis Day on Sunday. And to help unpack these, I'm joined live on the news by Senior Research Specialist at Human Sciences Research Council, Dr. Jeremiah Chikovore. Good evening from here. It's a pleasure to have you join me.
Good evening. It's a pleasure to join you, and good evening to the listeners and to your viewers.
All right, so tell me, what inspired the Human Sciences Research Council to host the tuberculosis seminar in anticipation of World TB Day?
Thank you. So the Human Sciences Research Council is a research organization that is based in South Africa, and it's one of the largest research organizations on the continent. And it works on producing and disseminating knowledge that contributes to policies and programs to alleviate poverty and reduce inequality. And it works towards the uptake of research for policy and for impact. So collaborations in the work of the HSRC are critical. So in the lead up to the World TB Day that is coming up, the HSRC has joined hands with the Aurum Institute and SANAC, or the South African National AIDS Council, to hold a seminar and share findings from research reflections on the topic of tuberculosis. And this, as you say, is a major and persisting problem. So joining hands to address this issue is critical.
Now, beyond sharing details on the findings of tuberculosis, what other key messages do you participants will take away from the seminar?
So, as you rightly say, tuberculosis is curable. It is treatable if it is identified early. So I think it's a tragedy that we continue to have deaths of this magnitude happening for a disease that is curable. And it is a disease indeed of inequity and inequalities. So part of the intention was to continue to highlight that tuberculosis is treatable, but also that tuberculosis intersects very closely with HIV. And as we treat HIV, we also need to be mindful of how our efforts can also contribute to the lessening of the burden of tuberculosis. These diseases are so intertwined that they've been called a syndemic. And we have seen from the trends in South Africa that when you work, we put effort into HIV/AIDS, that can put a dent on tuberculosis. So that is another critical message. And also, we also know that even though knowledge about tuberculosis in the South African population is high, there are still some misconceptions and some gaps. For example, people do not appreciate that tuberculosis is a leading cause of death. And we need to continue to highlight this message, to make it, to publicize it. And also that we indeed still have some people who acquire tuberculosis when they are HIV positive and they are not on treatment. That also is a tragedy. HIV/AIDS can reduce challenges related to tuberculosis, and we need to rope in as many people onto it as possible. So these are some of the key messages that we can highlight.
Well, there's something you said which I find very critical, which is you mentioned there is a high rate of tuberculosis in South Africa. I'm tempted to ask you why.
So South Africa is indeed one of the high burden countries across the world. And to answer that question, it is indeed a complex background to it. But one of the primary reasons is that tuberculosis, indeed, as it has moved around the world, has been driven by HIV in part. So in Africa, tuberculosis has been driven by HIV, but also by people who live on the margins, who live in precarious conditions. And so all those conditions intersect and put people at risk. But we must say that as South Africa has intensified its effort in terms of dealing with HIV, we have started to see also the benefits in terms of tuberculosis. However, it still continues to be a big problem, and we need to address it concertedly.
Dr. Jeremiah, in your field of research or work, have you noticed any recent advancements in tuberculosis research that you find promising?
In my field, and I must say I'm Dr. Jeremiah, and I'm a social scientist, a public health social scientist. So my interest is really in issues of equity, ensuring that people are treated equally, they have equal access according to their needs to amenities, to health, basic needs. So one of the interesting developments I have noted recently is the attention that is being given to the issue of nutrition and tuberculosis, how those two intersect. And this is an issue that is continuing to grow, and some colleagues working in Asia have been highlighting this issue, and we are starting to see it becoming more and more visible, but also in the broader context in which there is growing effort on how tuberculosis leads to what are called catastrophic costs and put people deeper into poverty at the same time that people are exposed to tuberculosis by poverty. These to me are interesting developments, and I think as a person who is interested in equity in health, I look forward to seeing stronger conversations following along those lines. But outside of my area, there are other developments that are happening that are biomedical and that are encouraging. And I certainly people who work in those fields would be able to testify on those developments.
Well, thank you so much for your insight on the news, Dr. Jeremiah Chikovore. Thank you once again.
Thank you for having me. Goodbye.